Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
NSAIDs. NSAIDs are the most common type of analgesics which are used are NSAIDs. These are actually heterogeneous drugs. These are equally effective. These have common mechanism. The mechanism of action of NSAIDs are they inhibit the enzyme COX and thus they inhibit the prostaglandin synthesis. So the main uses of NSAIDs are analgesic drugs, that is they decrease the pain, they decrease fever, so they are antipyretic drugs, they decrease the inflammation, so they are anti-inflammatory drugs, they are anti-thrombotic drug, and they cause the closure of patent ductus arteriosus in newborn. Side effects of NSAIDs are they cause gastric mucosal bleeding. They also cause bleeding. They will cause the bleeding will be seen because they inhibit the platelet function. Because they inhibit the platelet function, they will result in bleeding. They will also limit the renal blood flow is limitation is seen, which is resulting in sodium and water retention. These NSAIDs will also cause, they will delay or either they might even prolong the labor in asthma and in anaphylactoid reactions. In asthma or anaphylactoid reactions, they can be used in asthma and they cause side effects. They can either cause asthma or anaphylactoid reactions, especially in susceptible individuals.
thank you and thank you for watching.